Hello everyone, how's it going? Do you take thyroid medication for your hypothyroidism and sometimes have concerns about how well your body is absorbing the medication? Have you ever thought about taking your medication sublingually? Well, I've been hearing a little bit more about this and wondered if it was even possible. So we're going to talk about the disadvantages and the advantages of trying that method. If that sounds interesting to you, keep watching. Now, if you take your medication sublingually, that means you would place the medication under your tongue. You don't chew or swallow it. It just dissolves under the tongue. Now, this is something that is a concern for people to try because medical researchers recognize that many medications that have to be processed through the GI tract, sometimes it can vary the success of how well it works from patient to patient. And of course, many of the thyroid medications traditionally, that's the way they are processed, is through the GI tract. Of course, we would always want to speak to our doctor first before making any changes, but some people have actually had success taking their thyroid medication sublingually. Unfortunately, there's not a lot of scientific studies and only a small amount of medical studies on this method working with thyroid medication. So why would someone consider this? Well, there's so many factors that can influence whether or not our bodies will absorb thyroid medication. If you have medical conditions involving your liver or the GI tract, it can be challenging for your body to absorb the medication and to process it correctly. We know that when we take normal thyroid medication, you have to wait 30 to 60 minutes before you eat or drink anything, sometimes even longer if you're going to drink coffee, because that can interfere with the absorption of the medication. So let's talk about some of the benefits of trying this medication, trying to take it sublingually. Well, if it works for you, you could have rapid absorption, so you could feel better sooner. The absorption would be directly into the bloodstream, which would bypass the GI tract, which would help you to avoid the problems we were just talking about with the eating and drinking. You'd have more freedom about when you could take your medication and what you could take it with. You wouldn't have to worry about having an empty stomach, or what you wouldn't have to worry about if you take supplements like calcium or iron and having that interfere with your medication. You may actually feel better if more thyroid hormone gets into the body. You'd have less symptoms like weight gain, fatigue, hair loss, things like that. Now we're going to move on to talking about some of the disadvantages, but before we do that, I'd like to remind you to please like and subscribe if you're enjoying today's information. Also, always check out the links below so you can see the information, the references where I found the information. You can review that. And also feel free to leave a comment if you've tried the sublingual method and how that's worked for you. So some of the disadvantages would be that the amount of hormone that you're currently taking may need to change, which is why it's important to work with your healthcare team. They may need to alter the dosage that you take. Another thing that could possibly be a negative is you could accidentally take too much thyroid hormone, which could lead to heart palpitations and anxiety until you were able to have those adjustments made to the amount that you were taking. Also, not all thyroid medications can be absorbed sublingually. Sometimes that can vary from patient to patient whether that'll work. Also, many thyroid medications, they come bound tightly with inactive ingredients that makes it difficult to dissolve under the tongue because they weren't really made to be used in that way. Now, some people take natural desiccated thyroid, and that's hard even for the stomach to break down. So you would have to maybe even assist the process if you were going to take it sublingually by chewing or smashing it up, possibly putting warm water in your mouth first. Some people take it with a little bit of sugar or B12 lozenges. Now, there's the liquid formulations like Tirosint-Sol. That would be pretty easy to take sublingually. It may be possible to take the gel capsules like Tirosint if they were broken, and they may safely be absorbed, possibly taken sublingually. But when it comes to all other forms of thyroid medications, it's really going to be hit or miss. They may be able to be absorbed under the tongue, but it's not a guarantee. So it's possible that only a small amount would get absorbed or dissolved, and then the rest would be just swallowed. Another thing that might be difficult for some people is to be able to keep the medication under the tongue, especially if it takes a while to dissolve. It could be hard to hold that under the tongue for a long period of time. Well, with all these negatives, who might want to consider even trying this method? Well, if you tried several different thyroid medications without success, this may be something you're interested in trying. If you have gut health or malabsorption issues, if you've had surgery like gastric bypass surgery, or if you've had parts of the intestines removed, if you have a sensitivity to or allergies to the fillers and binders that are found in many thyroid medications, you might be interested in trying a liquid or something like that you could take sublingually. Most importantly, you would have to make sure you had a healthcare team that would be willing to monitor you as you're trying this option, because actually we never would want to make any changes without talking to our doctor, because thyroid hormones affect almost every organ in the body. So if we're not getting the proper treatment, not only are we going to experience symptoms that's going to make it hard to enjoy life to the full, but it could lead to some health issues, some serious ones, like high cholesterol and heart problems. So we definitely want to make sure we're getting the proper amount of medication that we need. Well, I hope you've enjoyed today's information, and I hope to see you in the next video, where we'll discuss another way we can improve our health.